everyone, it's Diana. Before we start, have you ever experienced a headache where you worried too much about what the likely reason might be and tried to research the symptoms and potential diagnosis online? Through browsing, you read about all of the potential causes, and the conclusion was that your headache was only caused by a lack of water in your body, a lack of sleep, or possibly the weather. However, as you dug deeper, you discovered that it may also be caused by brain cancer. And after some time, you started to worry what your headache might be a symptom of brain cancer to the point where you were constantly worrying about it and it was interfering with your daily life. Actually, it is one of the symptoms in a mental disorder that we call somatic symptom disorder. Here are the contents of this presentation. Somatic symptom disorder. We will now discuss first the description of it. It is also known as SSD and previously known as somatization disorder or somatoform disorder. It is a mental health condition characterized by the presence of physical symptoms that cannot be explained by a medical condition or another mental disorder. Individuals with somatic symptom disorder experience significant distress and impairment due to their symptoms. Now, we will proceed to key features of somatic symptom disorder. It includes somatic symptoms. The person experiences one or more distressing physical symptoms that may or may not be medically explained. These symptoms are typically related to pain, gastrointestinal issues, neurological problems, or other bodily sensations. The second one is excessive concern. The individual has excessive thoughts, feelings, or behaviors related to the somatic symptoms. They may worry excessively about the seriousness of their symptoms, constantly seek medical help, or excessively check their body for signs of illness. Duration and impact. The symptoms persist for an extended period, typically 6 months or longer, and significantly impact the person's daily life, causing distress or impairing their ability to function. Now, the severity of SSD can vary from mild to severe depending on the impact it has on an individual's daily functioning, quality of life, and level of distress. In mild cases of SSD, individuals may experience distressing physical symptoms that are not significantly impairing their ability to function or engage in daily life. These symptoms may cause some concern or preoccupation, but they do not dominate the person's life or lead to significant disruption. In moderate cases, the distressing physical symptoms become more prominent and interfere with the person's ability to carry out their daily responsibilities. The individual may spend a considerable amount of time and energy focusing on their symptoms, seeking medical attention, and undergoing unnecessary tests or treatments. This preoccupation can affect their relationships, work or school performance, and overall well-being. In severe cases, SSD can have a profound impact on a person's life. The distressing physical symptoms may be debilitating, leading to significant impairment in functioning and quality of life. Individuals with severe SSD may be highly disabled by their symptoms, experiencing extreme levels of distress and anxiety, and they struggle to maintain relationships or hold a job. They may also engage in excessive healthcare seeking behaviors, visiting numerous doctors or specialists in search of a diagnosis or relief from their symptoms. It's important to note that the severity of SSD is not solely determined by the intensity or numbers of physical symptoms. The level of distress, impairment, and the preoccupation with the symptoms is what primarily determines the severity of the disorder. and that individuals with somatic symptom disorder are not intentionally faking or producing their symptoms. They genuinely experience the physical sensations and distress associated with their symptoms, although they may attribute them to medical conditions or be overly concerned about their significance. The exact cause of somatic symptom disorder is not known, but it likely involves a combination of genetic, psychological, and environmental factors. It often coexists with other mental health conditions such as anxiety, depressions, or personality disorders. These factors are not mutually exclusive, and the development of SSD is likely influenced by a combination of these factors interacting with each other. Each individual's experience of SSD may be unique, and the specific causes can vary from person to person. Understanding these factors can help inform treatment approaches that address the underlying contributors to SSD. Treatment for somatic symptom disorder may involve a multidisciplinary approach, including psychotherapy, such as cognitive behavioral therapy, medications such as antidepressants or anxiolytics, and support groups. The primary goals of treatment are to reduce distress, improve daily functioning, and address any underlying psychological factors that may be contributing to the symptoms. If you or someone you know is experiencing distressing physical symptoms that cannot be medically explained, it's important to seek professional help from a mental health provider or a healthcare professional experienced in dealing with somatic symptom disorder. They can conduct a thorough evaluation and provide appropriate guidance and treatment. That's all with somatic symptom disorder. I hope this video helped you to know more about the said topic, and please spread awareness of mental health issues. Thank you and have a nice day. Bye!